Hi, my name's Deborah Campbell, and I'm sharing with you today school-based mental health education and services and why it is harmful to our students. Now, the background is Maria's Law, House Bill 1568, was one of four bills that laid the foundation for this program as well as comprehensive sex education. As you can see who the sponsors were of this bill. If you're in agreement with me, vote these legislators out. So what is school-based mental health education and services? Well, it is a program that places a greater emphasis on the psychosocial and physical environment. It's a Trojan horse for big pharma, medical, gender ideology, changing social norms, and sexualizing our children. It also converts our public schools into clinics or community hubs, as the professionals or proponents say. And the first phase is mental health services. So that includes gender affirming therapy, which is legal in Oklahoma. And here's the concern is if the ACLU prevails in Poe versus Drummond, the service component will expand gender transitioning. So you're looking at children would have access to referrals for pharmaceuticals and also referrals for medical transitioning. The other problem we have is there's no program consistency. So each school district is responsible for creating their curriculum, policies, and protocols. They can contract with any nonprofit organization to do the education component. And here's the scary thing. If they do this, then you've got organizations like GLSEN, Planned Parenthood, and in other left organizations will come in and educate your children. The other concern about this program is it's up to each school district. They can use the WSCC protocols, resources, and education videos. Now you can go to the Oklahoma State Department of Education website, type in WSCC, and you can read how the CDC expanded and created this program. And I recommend people go through and look at those videos because they also provide videos for teaching the children, and they are woke. They also promote the gender ideology. So it's very harmful and goes against the values of Oklahoma. So again, please go to that website and learn more about it. So they're the experts in the mental health field that support our values, that believe that the gender ideology and the school-based mental health programs are harmful to the children as well as to the parent-child relationship. They say that exposing the children to the buzzwords, that comes through the curriculum and so forth, that education component will create social contagions, delayed trauma, and again, it will destroy the parent-child bond. Furthermore, there is no evidence-based research that school-based mental health education and services improve academic literacy, improve standardized test scores, improve attendance, reduction of suspensions, reduction of juvenile justice involvement, and self-reported substance abuse. So the proponents, and especially the legislators that are fighting for this stuff, they say that the children need access to this and that it will improve academics. It won't. We're in bad shape as a state anyway, academically. Okay, so I said earlier that it converts our public schools into clinics or community hubs. I also shared the concern about this lawsuit. So right now, with Senate Bill 613, that was the law that the ACLU is claiming is discriminatory. Phase one of the mental health services is legal here in Oklahoma. So in other words, in Senate Bill 613, it says that minors can have access to gender affirming therapy. So that lays the groundwork, like I said, to later on, if the ACLU prevails, then these therapists, what they can do is they can make medical referrals. They can also make referrals for puberty blockers and cross hormones. Now, this is a few highlights of what proponents say about this program. And one is disturbing. They say that parents can't be trusted to ensure that their children's mental health needs are met. Since when do public schools become the surrogate parent? Now, as you can read on, it goes into about these hubs will ensure that every child's mental health needs are met. Parents, you need to step up and put a stop to this. We have resources outside of school for children's needs to be met. The mental health team determines what is in the best interest of your child. Well, guess what? I disagree. I believe the parent knows what is best for their child. Mental health education may be integrated in one or more subjects and also can be a standalone course. So the teachers who want to go into this arena, they have to get micro credentials to teach this stuff. And then the big concern for me is no transparency regarding these individuals, these so-called professionals that will be doing we don't know what is their former education training, what specialties. So these are things that if you're going to have your child go through this program, then you better do some background checks on these individuals to see if they are qualified to work with your child. All right, so Oklahoma is 44 nationally. That's how we rank academically. We should be so embarrassed. Yet they're spending all this effort to create school-based mental health education services. Now, Hoffmeister, she is the one that brought this in to Oklahoma, and she is the one that is responsible for this. And she promoted the comprehensive sex ed and the mental health, saying that the children mental health needs have to be met before they are ready to learn. So again, I disagree with that. Yeah, there are some children that they may have a disorder or something that does interfere with learning. But again, that's the responsibility of the parent to be working with an independent source or professional, and then together they work with the school and inform the school, okay, this is how, this is how you can help the child learn. But anyway, that's a whole nother subject. All right, so the experts and proponents, they say that in order for this to be successful, you have to have a buy-in from the teachers, parents, community, and there has to be funding. This was very interesting. Joy Hoffmeister, from 2018 to 2022, these are grants specific to mental health services that Hoffmeister applied for and received. Now, keep in mind that the Maria's Law did not pass until 2021, and the other relevant laws. So the program didn't even get started until 2022 and 2023 school year. So this raises questions. So you've got the bills were codified in 2021. And you saw the millions of dollars over the years that Hoffmeister received. This raises the question, what did Hoffmeister do with this money? If the programs if you did not implement them until, 22, 23, where was all this money going to? What was it going to, and so forth? There's a lot of questions there. So I listed 3 that are relevant to grants. What, we need to see what the expenses were. We need to know what the prime awardee, what their expenditures were in the sub-awardees. I mean, these 3 areas, there needs to be an audit, a forensic audit, not just a regular audit. All right. Now, the other piece to the school-based mental health is Medicaid expanded. We have a program called Oklahoma School-Based Medicaid. And I did some research. I did find there were some schools where the principals had abused this program. And this is a big concern. And I know in 2004, when IDEA was revised, there was a prominent attorney, and his name is Pete Wright. He raised concerns about abuse of Medicaid under IDEA because of the how they changed the verbiage in the Federal Register. And I have this concern now with school-based mental health, because now you're going to see a surge of IEPs for anxiety, depression, gender dysphoria, other disorders. And you have to keep in mind that under IDEA, there's only 13 disabilities that makes a child eligible for an IEP and eligible for protection under IDEA. Then you've got intentional and unintentional fraud, and you're going to have an escalation of enrollment in Medicaid. And the other danger is this is being marketed as a convenience for parents, one-stop shopping. parents don't have to worry about going to an independent therapist outside of the school. They can just, have it all taken care of in one place. All right, take action. I listed 5 actions that people and parent groups and the GOPs can get involved in. Because remember, this affects the community. It has tentacles everywhere. So you don't have to be a parent. It's going to affect everybody. And we have a duty to protect our children. So you write to Ryan Walters, demand the immediate termination of this program. Tell Ryan Walters and Governor Stitt to perform a forensic audit of these grants from 2018 to 2022. Also tell Ryan Walters and Governor Stitt to perform an abuse audit of the Oklahoma state-based Medicaid for each public school. That's the key. You just don't pick a few schools. You've got to do them all. And I'm not saying that all the schools abuse it. I'm just saying that has to be done for every school as a precaution. Then you can write and call each state board member and demand that they immediately shut this down. And then parents make a written objection and withdraw based on harm from participating in this program. And you can use the Oklahoma statute Title 25, Section 2003. And if you perceive that curriculum, program, or course is harmful to a child, and it is not it's not focused on sex education, this is broad. Anything. So if there's anything that you perceive harmful as far as curriculum, programs, activities, then you can object on that basis that it's harmful, and they cannot have your child involved in that. And if it's let's use the example, if they're integrating LGBTQ inclusive curriculum in civics or social studies or some major course, they have to provide the course to your child without that particular section, without the LGBTQ curriculum. So that's one example. The other thing you need to be concerned with, and you can use Title 25, Section 2003. You can make a written statement that your child will not be part of the data mining. They will not participate in anything where their personal information is put into the database. The only thing that you should be allowing that's relevant to an education record would be just some basic information about the child, so the record follows the child to college or to a trade school or whatever. But anyway, you get the point on that. So please share this information with others. Please take action. Thank you.